Okay, it is now Sunday the 7th of August, and in exactly 48 hours I'm going to be right in the middle of my surgery for my right mastectomy, which is all very daunting, despite the fact that I've been whining for the last few weeks about how long it was taking and having to wait and just wanting it out. Now that it's imminent and I've only kind of got 24 hours left to prepare myself, I think this little sense of panic is setting in. It's like, oh, I've got to do all this stuff. Like I have to explore my own feelings, get in touch with my feelings about it, and meditate and get myself in a calm, accepting place, and all of that stuff. And of course, the more frantic and worried you get about all of that, the far less likely it is that you're actually going to get in touch with your feelings at all, because you're just going to be in one kind of whirling panic of overthinking everything. It just seems like now that it's imminent that I just feel like I am running out of time to really get ready for it. And despite the fact that I've had every single brochure and the contents of all of the show bag and stuff from Bosom Buddies, and everything's been like on the counter in the kitchen, and I've just poured over it with a fine tooth comb, I feel like I'm like cramming for final exams or something, just to make sure that I do it right. I don't want to fail, but I don't know that there is any doing this right. I think it's just gonna come whether I'm ready or not, and how I react to that on the day and when I wake up and how I feel about it later. I can't afford to second guess that. I'm just going to have to be ready for whatever comes and just lean on the people around me as best as I can to deal with how I'm feeling about that at the time. So I think the thing that I'm really, really having a hard time about is just what it's going to feel like to wake up and then go, oh, that's different. Maybe I'm just, getting too ahead of myself, because I think, obviously straight after surgery I'm going to wake up and I'm just going to be really groggy and probably feel sick and nauseous and disorientated and have a whole lot of pain for the first couple of days. So maybe I'm just getting ahead of myself, because obviously that first couple of weeks it's going to be a gradual increasing awareness and awakening to what's actually happened, and it's all going to look pretty horrible to start with until the scarring and the inflammation settles down anyway. So tomorrow I have planned some nice things for myself. I'm going to go to the beautician and the hairdresser and kind of get myself looking as nice as I can for somebody who's going to wake up looking like a bag of crap. And I'm going to have a massage if I can find someone to give me a massage. I'm going to download lots of podcasts to listen to in hospital and during my recovery, thanks to my gorgeous girlfriends who all had loads of wonderful suggestions about books and podcasts that might fit the bill. So I'm going to load a whole bunch of books on my Kindle. I've got a little collection of little treats for my family to bring me in hospital, like my favourite kind of chocolates and things like that. They're under instructions to bring to the hospital for me to cheer me up. And then come Tuesday morning, even though it's an afternoon surgery, it's not going to be a sleep-in day, unfortunately. So I will still have to leave home by about 8 in the morning to get to a radiology at the hospital in the morning, even well before I check in as an inpatient. They're going to be doing something called a lymphoscintigraphy. So this is a nuclear medicine scan where they're going to inject some radioactive kind of molecules into the area around the cancer, and they're going to be then looking for those where they drain to in the lymph nodes underneath the arm here, because in surgery the surgeon is not only going to be taking or shelling out the boob, because it's a skin and nipple sparing procedure, but then they're also going to have to go and take a few of the lymph nodes for sampling to make sure that the cancer hasn't spread outside the breast, which could signal that maybe some cells have gone even further than that into other areas of my body. So it's very important to for them to track down and just trace the extent of whether the cancer has spread. So yeah, I'm going in for the lymphoscintigraphy at 8:30, 9 o'clock in the morning. And then a couple of hours after that, well, I mean, it could take a couple of hours for the scan apparently anyway, but a couple of hours after that, then I go to the intake lounge where I actually get brought into the hospital. And then in the afternoon on Tuesday, the 9th, I'm going to be taken into surgery.